Welcome to Virtual Reality in Medicine and Surgery. We're going to show you a procedure called DJ stenting with a laptop cystoscope. Normally you need all the monitor, camera, light source and the entire expensive work for doing a cystoscopy or minor procedures. But with a laptop cystoscope, all that you need is just a laptop and the laptop cystoscope. After draping, as for regular surgery, you start with giving a little bit of local anesthesia. And then it's better to pass the cystoscope like this. Then once you're inside the bladder, to turn. Now we are inside the bladder. And you can see the bladder. It's a grossly trabeculated bladder, and now we are going to locate the right ureteric orifice. Okay. The first step is to pass a guide wire. There you can see the orifice which is opening. Give the guide wire here. The guide wire had two ends, a floppy end and a rigid or stiff end. It's a floppy end which has to go inside. We pass it through a pusher to make it stiff so that the guide wire can easily go. So we are close to the orifice. And now you can see the guide wire slowly getting into the ureter. Okay. Now it doesn't go anymore, and that's the place when you stop. Hold the scope. Hold the scope. Okay. Then you need to take it over by what's the method called push and pull. You push the guide wire inside and pull the pusher out so that the guide wire doesn't move or slip. Okay. So once it's taken out, the next step is to pass a DJ stent. Leave it. Okay, now you can see the orifice nicely and the guide wire going into the orifice. Now we are passing the stent inside. The guide wire has to be taut or straight. It should not bend like this, and it should do push centimeter by centimeter slowly. Now you can see it going inside the orifice. Okay, now give the pusher. Again, the same principle. The guide wire has to be taut, so you hold it close to the body and this thing, and slowly push the DJ stent inside. Okay, now we are almost reached. Now pull the guide wire out. You can see the stent and the pusher. Okay, we have done the DJ stenting on the right side. Okay, so if you want to look at the rest of the bladder, you can go and turn to the right to look at the right wall. Again, turn to the left side to see the left lateral wall. Turn here to see the dome of the bladder to make sure that the fundic air bubble. Okay, then we take it out. Okay. So this is a simple device which can be used for DJ stenting.